Hi Steph, today we're going to be doing the SFMA test. That's going to test your mobility from your head down to your toes. What I need you to do is I'm going to ask you to do a couple of things and show you an example myself, and then you're going to do them. Make sure that if there's any pain that you let me know, okay?
Okay.
Alright, first we're going to start off by bringing your chin down to your chest. Can you do that for me?
Sure.
Good. As you can see, she can't quite make it. If she bent her shoulders forward, she's able to do it like she was doing before. Alright, now what we're going to have you do is we're going to have you bring your head all the way back. Again, trying to keep your mouth closed. Good. And as you can see, she's within 10 degrees, so that looks pretty good. Next, what we're going to have you do is we're going to have you rotate your head and try and touch your chin all the way down to your shoulder, to your collarbone. Good. You can see she's moving her shoulder forward because she can't quite get her head down there. Alright, and to the other side. Good. So, it looks pretty good. She's just cheating a little bit, but it's definitely functional. Was any of that painful?
Nope.
Good.
Tight, but...
Alright, the next test we're going to be doing is going to check shoulder mobility. What I need you to do is I'm going to have you bring your right arm behind you. You're going to go into extension, internal rotation, and adduction. And you're going to touch the inferior angle of your shoulder blade. So, if we can have you turn so the camera can see. Alright, so take your right arm and touch where my finger is. Very good. Now, if you can do it with your other arm as well and touch where my finger is. Her feet are together, which is good. Back down. Good. Now the next one we're going to be doing is we're going to take your right arm again and we're going to go into flexion, abduction, and external rotation and try and touch the spine of your scapula, which is right here. So if you can bring your right arm and touch where my finger is. Good. Now if you can take your left arm and do it again. Very good. She didn't have any restrictions doing that. She was very fluid and it was very good. Now we're going to be performing the multi-segmental flexion assessment. What I'm going to have you do is I'm going to have you put your feet together and I'm going to have you bend forward at your hips and try and touch your toes. Don't bend your knees. Can you do that for me? Let me know if there's any pain.
Okay, so feet together.
Good. From here you can see that Stephanie has a very flat back. There's not much curvature at all. Her sacral angle is not at 70 degrees. And then also you can see her trying to bend her knees, which makes it appear that she has tight hamstring. This test is the multi-segmental extension assessment. What we're going to be doing is we're going to have you put your arms up by your ears, feet together, and then bend backwards as far as you can. What this is testing for is extension of your arms, spine, and hips. See if you can do that for me.
Ready?
So what you can see here is that the spine of her scapula gets past her heels, but she has a very sharp curvature in her lumbar spine, and she doesn't have very much, you can stand up, she doesn't have much curvature in her thoracic spine. As you also saw, she was shaking her abs a bit, which indicates some weakness. Her hips also did not make it in front of her toes, which is something that this exam needs as well. This test is the multi-segmental rotation assessment. What this is going to be testing is your spine rotation and your hip rotation and your cervical rotation. Okay? So what I'm going to have you do is stand with your feet together, arms out by your sides, and then I'm going to have you rotate both of your hips and also your spine and your head in so you can look behind you. So if you can turn this way, good. Now if you want to twist to the right for me. Good. Here you can see that she's tipping her shoulder down towards us, and she's also has a bit of restriction in her hips coming towards this direction as well. She doesn't have very much rotation with her thoracic as well. And for the other direction. On this side you can see it's even less. She isn't able to get past the 50 degrees that you need for the spine rotation. Her cervical rotation is good, and her hips are okay. They aren't rotated as far as she can go. Alright, this test is the deep squat test. What we're going to have you do is have your feet out slightly wider than your shoulders, and then you're going to bring your arms up, and then what you're going to do is you're going to go to a deep squat. I'm not actually going to perform the test the whole way because I can't do it perfectly myself. So, if we can have you spread out here. Yep. Good. Your feet are now wider than your shoulders. Bring your arms up.
On the table.
Yep. Arms up. Good. And now if you can go down all the way. Alright, so what we can see here is that her arms come in front of her toes, and that her back is very straight. Her legs do break parallel. Her knees aren't coming together, which is good. So overall, she's doing pretty well. It just seems that she might have some tight hips, which has her bend forward. Alright, can you now face the camera and we'll do it again?
Yep. I'm not gonna hit the table.
I'll make sure you don't hit it. Good. And as you can see, the hands do come forward. Other than that though, her feet are flat on the ground and it looks pretty good. Next, we're going to have you do the single leg stance. Okay, what this is I'm going to have you stand up nice and tall, keep your arms by your side, and then I'm going to have you lift up your leg. Okay, so that it makes 90 degrees at both your hip and also at your knee. Can you do that for me?
Sure.
Good, you can see nice, even 90 degrees. And she's able to hold this for 10 seconds. 2, 1. Let me put that down. We're going to have you do that again, except we're going to have you raise it up and then close your eyes. And we're going to do that for 10 seconds as well. Good, she's at 90. 9, 7, 8, 9, 10. Got a little bit wobbly there. That's okay. Now we're going to have you turn, and we're going to have you do your other leg. So you can lift up your right leg. Good. Your left leg, sorry about that. It's at 90 degrees. 5, 6, 7, 8, 9, 10. Good, you can put that down. And we're going to have you do that again, except we're going to have you do it with your eyes closed, okay? Good. Freeze this up a little bit more. Good. That's at 90. Hold it there. 3, 4, 6, 7, 8, 9, 10. Very good. So she had a little bit of sway, and she also was raising up her hip during the test, which indicates that she could have a weak knee and she was trying to compensate. Go.
So we're doing the multi-segmental flexion breakout because earlier when you tried touching your toes, we noticed that you had a little bit of dysfunction with that. So we're going to try and figure out exactly what is wrong to help you figure out if it's tight, if it's joint problem, anything like that. So instead of having both legs straight, I want you to bend one knee and try and touch your toes to the floor, or hands to your toes.
Alrighty. Without bending my knee?
Yes.
My other one? That's as far as I can go.
And you can still see that she has tight hamstrings and that her back is not very curved. So you can come back up, and we're going to do the other leg. Good. To come down, touch her toes. Good. Same thing here. She's actually leaning towards that side of the leg while her hips dropped as she does this, and her back is relatively flat. So the next test we're doing, you're going to sit down, have both legs straight out in front of you, feet together, and you're going to reach towards your toes. Okay? So let me see. All right. So we want to look at the sacral angle here, and you can tell that it's nowhere near 80 degrees. She's still really vertical here. So you can come back. For the next test, we're going to do an active straight leg raise. You're going to lie on your back. You want to keep your back flat on the ground and your other leg straight. And then lift up, keeping a straight knee, and then lower back down. Let me know if you have any pain with that. All right. you have any pain with that?
Nope, just
You can
tight.
You can also see she's struggling to hold her leg up just to get her leg there. Her abs tightened up right when she was there. And if she goes any further, her back will start to arch. There you go, you can lower back down. And the other leg? And back down. The next one is passive, so I don't want you to do any movement, and I'm going to lift your leg up for you, okay? So keep your leg straight, and then I'm going to lift this up and see how far you come before you arch your back. So right about there. And I would say it's probably around 70 degrees and back down. But your leg just turned out a little bit.
Yeah.
All right, so we're going to do the same thing on the opposite side. We're going to lift up, watching out for that curve in your back. So I'm going to say it starts to turn right about there and back down.
And there's no pain.
No pain? Perfect, thank you. So because you are able to get to 80 degrees passively with your single leg raise, we're going to do another test to see exactly what is wrong and where it's tight and things like that.
Okay.
So what you're going to do is lay on your back. This is called knee to chest. So what you want to do is just what it says. Bring your knees down to your chest, and you can hold on to the back of your thighs as you do this. All right? So go ahead.
So, bring my knees.
Good. And do you have any pain with this?
No, it actually feels good.
So because you have no pain and this is functional for you, I would say that you have tissue extensibility dysfunction as well as stability and motor control dysfunction.
Which would make sense because my core felt weak when we did the other test too.
Yeah, exactly. I'm glad that made sense.
So after doing the SFMA and looking at the analysis, we found my hip flexors are really tight. My back extensors are really tight. When I stand, even kneel in neutral, and this is normal, you can see that my back is arched. Normally, I'm like sitting on my spine, and I have a hard time trying to get my hips forward because of the tightness. So what we're going to do is we're going to foam roll the quads, and you can use a small or a large foam roll. And what I'm doing for this is I have my knee down to help support my other leg. But if I want more pressure, crisscross the legs and just roll back and forth right onto the quad. And you can already tell that it's really tight as I'm going along it. I can really feel that. So, and then, like we said again, back extensors were tight. Normally I would use a larger foam roll, but this is what we have. So for this, you can keep your hands crossed like this, or arms up. The purpose for doing that is so that your shoulder blade's out of the way, so you can actually roll on your back and not onto your shoulder blade. And you can see as I'm doing it, when I get to the end point, because this is also core control, and my core is weak, as I get to this point, you can see I start to shake a little, and that's because my core is really weak. So this is good because if you're doing a larger exhale and a bigger inhale, and a big inhale, you're relaxing the muscles, but you're also getting a little bit of core control as well. And that's for foam roll. Okay. So the next exercise we're going to do is a kickback. This is because we have active insufficiency with the quad, so we're having passive insufficiency with the hamstring, so they're probably going to be weak. So we're going to try to strengthen that in the glutes, so the posterior chain. So for this one, we're just doing a kickback. make this easier, you can do it without weight. And to make it harder, you can increase the weight or have someone lying down and kicking up against gravity. That's it. The other one we're doing is a hamstring kickback.
Also known as a hamstring curl. Can do it with the weight, with the TheraBand, also lying down, and if it's too much against gravity, you can have them on their side. So for this next exercise that we have for Stephanie, we're going to stretch her quads. So what we need you to do is lean back, tighten your abs, good, and then go forward and shift forward while maintaining tight abs. She's leaning forward a bit, but that's because she still has really tight quads. This is probably a really good stretch for her. And as you can feel that. We'll progress it and take away the pull so that she'll have to then use more stabilizing muscles and use her core as well.
The other things with this too, you want the person's hips to try to be level, and you also want to make sure that they're not compensating by arching their back more. So I'm really trying to pull my hip forward, but this is as far as I can go right now. Alright, so the other hamstring one that we could do is in a chair. So because the hamstrings flex the knee, you're going to dip your heel in and pull, and pull, and pull, and try to stay on track. And go all the way down. Now this chair moves pretty easily, so we can make this harder by going on a different surface or a rug. Or at a clinic, we used to add like those sand weight bags to the back, and that would make this difficult to pull. We're good?